Good morning. Welcome to our quarterly virtual public forum for the Washington Statewide Refugee Advisory Council. My name is Sarah Peterson. I use she, her pronouns, and I have the honor and privilege of serving as the Washington State Refugee Coordinator. Please take a moment and introduce yourself in the chat box. Use your name, preferred pronouns, and organization. We're so glad to have you here with us today. We have a very full agenda, and I just want to review a few virtual meeting protocols. All participants will enter the conference, the Zoom, in mute. Please keep yourselves muted during the panel conversations. Be conscientious of any background noises that you may have. Time will be provided for questions and answers, and the chat box is a great place for you to use to answer your question or to put in your questions and your comments, and raise your hand if you would like to make a comment. Today's public forum is being recorded. It will be available to participants upon request and will be posted to the DSHS website. If you have any technical questions or concerns, please feel free to email our administrative coordinator, Hamed Hakimkel, at hamed.hakimkel@dshs.wa.gov. For more than 30 years, Washington State has had a Refugee Advisory Council that has served to inform how the DSHS Office of Refugee and Immigrant Assistance works and provides services to refugees and humanitarian immigrants across the state. We recruit members from each area that has high concentrations of refugee arrivals and our counties that are home to refugee resettlement agencies. We recruit 2 council members from each county and 3 in King County, the county that has the highest concentration of refugees. At least 1 council member in each area must come from a refugee or immigrant background. Many work in organizations that contract with our office or provide services to refugees and immigrants. Today, the Refugee Advisory Council members will be facilitating the breakout sessions that we will be having later during our program. We're so excited to have them all here with us today. I'd specifically like to call out a few Refugee Advisory Council members who will be leaving us who have served 4 years with us. And that's Jason Scales from the Tacoma Community House, and Margarita Marochikina from Partners in Career. Thank you, from Partners in Careers. Thank you so much for your service, and we are grateful to you. The United States has been a critical partner in responding to the global refugee crisis through refugee resettlement and international aid. The process of resettling in the United States is administered within the federal government and involves multiple federal agencies that assist with refugee admissions program, reception and placement program, and the refugee resettlement program. Today, we are very fortunate to be joined by 2 leaders from the U.S. Departments of State and Health and Human Services to help us better understand the work that is happening to rebuild the refugee program today and over the next few years. I'd like to take a moment to introduce Larry Bartlett and Ken Toda. Larry has served as the director of the Refugee Admissions Office at the Bureau of Population, Refugees, and Migration since 2010. Prior to joining the State Department, Larry served as a U.S. Peace Corps director in Jordan and Bulgaria, and he is also a returned Peace Corps volunteer. We would also like to welcome Ken Toda. Ken has served as the deputy director of ORR since 2008. Ken has experience serving as a senior program specialist with the Immigration and Naturalization Services before it became the Department of Homeland Security. Prior to joining the federal government, Ken worked was the Cuban Haitian program coordinator for the United States Conference of Catholic Bishops. Welcome, Larry and Ken. We'd like to go ahead and ask each of you to do a few minutes of brief remarks on speaking to rebuilding the program. And then I have a few questions for each of you. Larry, would you like to go first?
Sure, happy to. And thank you for inviting us, and really a pleasure to be with all of you, even if it's virtually. As Ken and I were saying earlier, it would be more pleasurable if we were with you in person, but we hope to do that someday. So I actually need to work with Sarah a little bit on one of her slides, because the slide we just saw about USCIS, PRM, State Department, and HHS, I need to make a small correction, because on the front end, yep, there you go. So, so when you look at the security slide, pre-screening by resettlement support centers, those resettlement support centers work for the Department of State. And so, you know, we have the bulk, frankly, of the overseas processing responsibility, but the final adjudicatory authority is with the Department of Homeland Security, which it says at the top. So frankly, my office spends a lot of time and effort on the front side of this program. We spend some time, it's critically important on the placement process and the first 30 to 90 days. But of course, our partners at ORR are a more important kind of a longer term bulwark for you. Okay, now you can move the slide off. but in that, I just want to set that context. Oh, so okay, so I want to set that context because on the overseas side, we are working incredibly hard to try to meet the new administration's goals to build to 125,000 refugee arrivals. And it's going to be difficult. We actually have a lot of refugees in our pipeline, but largely because of COVID at this time, it is really hard to access those refugees safely. For our overseas centers, we have 7 of them to really participate in-person interviews as well as out processing and put people safely on a plane. So I won't, won't kind of sugarcoat it. You know, rebuilding, this year we have a ceiling, a target of 62,500. I think the administration's been very clear we will not meet that target. I will be the first one to agree with that. But we've been asked to do what we can. And so we will be pushing hard between now and the end of September to try to use the slots available to bring refugees to the US. And I think we, like you, very much understand the operating environment, the living environment, the protection environment in which refugees live. And so we really do want to help them travel to the US this year. And we want to build to 125,000, which the administration has announced will be our goal next year. That will be equally hard, but we will work towards that goal. I think there's a couple things going on, and I think we'll start with COVID, because the COVID operating environment overseas is much worse, much more dire than it is here in the US. I think largely people in the US who've wanted to be vaccinated have had an opportunity to be vaccinated. Overseas, it's the opposite. We have operating environments. Nairobi is one, Kiev is another, and Bangkok is another, where COVID is going up and down in terms of the nature of it and the incidents, and also kind of the restriction on movement. Turkey is another place. The government has put heavy restrictions on movement. So even getting refugees or getting our caseworkers in front of refugees has been super hard. And very few of our caseworkers have been vaccinated. And of course, probably almost no refugees have been vaccinated. So we're very conscious of the risk that may be posed in operating this program. And we really do want to safeguard, the health of everybody in this endeavor. So we're looking to see what kind of, modifications or remediations we might be able to accomplish. But securing vaccine overseas for our partners is something, while we're pursuing it, we have not yet been able to accomplish. And again, if you read the newspaper about vaccine availability internationally, you'll understand how complicated that is. So that's, I think, the number one and maybe number 2 and number 3 factors that really is kind of going to limit arrivals this year, hopefully not so much next. The other thing that we've been doing since end of January, beginning of February, when the president issued an executive order on the resettlement program, is to really work through a number of new lines of kind of policy interest for this administration. And so they've really asked for kind of a top to bottom review of the program. One of the elements is anti-fraud. I think people, hopefully you know that there was a massive fraud ring perpetrated, was run out of Amman, Jordan, but perpetrated against the Iraqi P2 refugee program. So we've been asked to, first of all, suspend that program, which we have, and second of all, to really look at the types of fraud that was perpetrated and to try to safeguard and mitigate against that in the future. So that is a big task. We are working through that. We certainly have not finished that endeavor, but we will continue to work through it. And frankly, for all of you who may have an association with the Iraq program, it will remain suspended for the foreseeable future until we really can re-verify the people who are in that program. Another piece of it, which is related but not exactly the same, is really the security check process. And so many administrations, not just the last, have really looked at the security check process for refugees to see how it can be improved, which means strengthened, which populations should be included, which shouldn't be, and then how do we find efficiencies. So this administration has done the same, and what they really would like to see is that the vetting agencies really achieve greater efficiencies in the process, so it's faster, and so but just as thorough. And so that is a process that's still working through. We are heavily involved in that, and I think, frankly, we'll have great dividends. It'll probably be another year, but we will have, I think, quicker checks with the same types of integrity. Other things that were mentioned in the executive order, which kind of relate to this, one is backlogs and efficiencies. That has a kind of a nexus with staffing levels. People may know that the DHS staff who do overseas interviews, many of those staff left under the last administration and were not replaced, so they are in a rebuilding mode right now. We need those interviewers. They're the ones on that chart that you saw that actually have to do an interview for a refugee before they are allowed to come to the US, and we desperately need them both in volume in terms of number, and we actually need them to go back overseas. They have not been overseas for over a year now, and so we're hoping that sometime later this fiscal year they will begin to do circuit rides again. But without those circuit rides, we're really constrained in terms of kind of building the program forward for next year. For this year, we're really focusing on people who've already been interviewed by USCIS and are just awaiting other steps, such as medical checks, security checks, or other administrative work. So that's really our focus this year, is people who've already been interviewed. Next year is really trying to get more interviews accomplished. And then a couple other things I would mention: community co-sponsorship and private sponsorship. This administration has been very clear that they would like a program set up and established by a private sponsorship program established by January, which we are working towards. We're working together with Ken and his team to set up something that will kind of really amplify kind of local engagement by using local sponsors. We're not fully there yet in terms of the plan, but we are working towards piloting something by January. And then finally, I would say, just on the referral network, we've gone back to UNHCR. We've asked them for another 50,000 referrals to kind of replenish our pipeline. And we're also trying to work through this concept that was mentioned in the EO about increasing the number of referrals that are made by NGOs. It's normally not a large referral mechanism for us, but what we're looking to see is how they can add value to a system that UNHCR already operates, but where are the niches, or where are the populations perhaps that we're missing. So I think I'm going to stop there and look forward to questions.
Great. Thank you so much, Larry. We're so excited to have you here with us today. We're going to go ahead and turn it over to Ken. And Ken, thank you so much for joining us. And go ahead. Why don't you go ahead and just give us a few brief remarks?
Thanks, Sarah. Great to see you and be joining today. Certainly be joining with Larry and also some colleagues from ORR, Melissa Halbert, Jordan Beck, and Lord Edwards are also joining today. But as many of you may know, so I'm work at the Department of Health and Human Services Administration for Children and Families. So we work extremely closely with Sarah's office, the Office for Refugee and Immigrant Assistance. I will say, I think Washington's always been recognized as such a really innovative partner in providing really integrated and longer-term services and supports for refugees. I think the community, certainly in Washington, has been so supportive of certainly the resettlement program and has really been so innovative over the many years of providing services throughout the community. So really want to certainly commend all those joining today for all the great work and certainly partnerships throughout the community to really maintain strong services and supports for refugees. And certainly the ongoing support for the Unaccompanied Refugee Minors Program, I know has been a long and historic program within the state of Washington as well. As an example of some of the innovation, we do really want to highlight certainly your recent COVID-19 Immigrant Relief Fund. Even though that does support certainly members of the entire community, it also really seemed extremely helpful to other refugee and OR populations during this time. So really want to commend you and thank you for that support and certainly support during the challenging months as a result of COVID-19. Mentioned this is, I think, a really exciting time for the U.S. resettlement program. I think we've all known that certainly the lower arrivals over the past few years have certainly had an impact on the network, but now is really a time where we really get to focus on rebuilding and really look at ways that we can really strengthen the program. And I think there's a great deal of excitement around that. Larry mentioned one effort certainly around certainly community and sponsorship, which I think will be a really innovative way to bring community even closer into the overall resettlement process. And certainly I think communities will play such an important part of certainly maintaining and providing services and supports to refugees as we look to bring in higher numbers in the coming year. I really want to stress how much support I think we have certainly in the new administration and certainly within HHS from our Secretary Javier Becerra, our Assistant Secretary Ju Chang, and our new certainly OR Acting Director Cindy Wong. They're really so committed to this program and so interested in really building back and really the mission of ORR to really build really integrated and longer term services, which we know are so important to really maintaining and providing self-sufficiency to refugees upon arrival to the U.S. Part of the commitment, I think, is really demonstrated in a snapshot, I think, of President Biden's FY22 budget request, which did indicate some overall funding levels to ORR of $4.3 billion. This is a significant increase and really at historic levels for ORR. The increased appropriation really would help OR rebuild the infrastructure and is noted to support resettlement of up to 125,000 refugees. So that's significantly over certainly the levels we have been over the past few years. It would also support and hopefully an increase in our survivors of torture program. So hopefully we'll be able to talk in a little more detail about sort of the specifics of that budget. But certainly we really want to emphasize the support to really not only support increased arrivals, but then to also provide additional supports to provide a much deeper level of services moving forward. And some of those that we hope to include and really focus on are many areas that I think we have talked about within the program for many years, but just really haven't had the opportunity in terms of our appropriation to support some service components around women and youth, certainly mental health and mental health capacity building, and then really overall capacity building and really focusing on how to bring community members in through volunteer coordination and other sponsorship supports. I think we all recognize certainly the services for refugees really is a long-term commitment and often does go beyond our funding. So obviously outreach to all levels of the community is so important in that process. And I think there are some tremendous opportunities that have really come forth recently as regard to the American Rescue Plan. There are billions and billions of dollars, even administrated through the Administration for Children and Families, which focus on childcare and a host of other community supports that I think will be some valuable resources and require sort of ongoing outreach, which we hope to work very closely with our state partners to help navigate and certainly build connections for. In closing, I did want to also mention we have a number of granted opportunities that are certainly in the domain at our grants.gov. Those are also in the application certainly phase right now, so certainly want to emphasize those and make sure you're aware of those. Those include the Career Pathways Program, the Refugee Family Child Care Enterprise Development Project, our Preferred Communities Program, our Individual Development Account Program, and our Micro Enterprise Program. It's very very rare a year that we have so many, certainly all in one phase, but all of these are in the application phase now, so certainly encourage you to take a look at those. We would be expecting to make those awards by the end of the fiscal year for services in FY22. So hopefully those may be of interest. And I think I'll really want to emphasize again what an exciting time this is. We really look forward to working with Sarah. You have such a strong leader as your state coordinator, and really look forward to learning more about your programs and really helping you to build back better. So look forward to some questions. So thank you.
Thank you so much, Ken, and thanks for elevating those opportunities for our community partners who apply for different grants. I have several questions for Larry and Ken. I do see that Mark Finney, one of the directors of the Resettlement Agency in Spokane, has his hand raised. So I'll go ahead and invite Mark to ask his question.
Great, thanks, Sarah. Thanks, Larry. Thanks, Ken. Appreciate your leadership and really appreciate you taking the time to meet with us today. My question has to do with some specific population groups. So, and Larry, this may be more for you, but there's two groups that I'm curious about. One with the U.S. withdrawal from Afghanistan. Could you give us a little update on what might be happening there with Afghan SIVs or Afghan refugees? As I've read a little bit about the possibility we may see an influx there before the final troop pullout in September. The second is many of us in Washington have resettled Rohingya refugees over the years who've made their way to Malaysia, Indonesia, Australia, other places where they qualify for a third country resettlement. But my understanding is that the roughly 1 million or so in the Bangladesh area around Cox's Bazar don't qualify for a third country resettlement. I had a chance 3 years ago actually to visit those camps in person. And we have, folks here in Spokane whose family members are there who would love for them to be resettled. Is there a possibility, especially in light of Myanmar's government basically collapsing or being on the brink of collapse, that we could see a shift there so that the Rohingya in Bangladesh may become eligible at some point in the future for resettlement? So kind of two questions, but really appreciate it.
No, that's fine, and they're both really good topical questions. So the first question on Afghans, of course, there's a lot of planning going on here in this town, in this Washington, but also in Kabul, about how does the withdrawal, how do we exit in terms militarily? We very much intend to keep our mission going there. We very much intend to keep our programs going as long as it's feasible to do that. So the plan is not to evacuate. The plan is to withdraw our military. But at the same time, we understand the complexity of, I think, the environment, and people are planning for various scenarios, right? And so the SIV program has been the kind of, all efforts, frankly, have been redoubled on the SIV program. I'm in many meetings on that program, even though we don't operate it, but we obviously do provide SIV benefits and travel loans to people. So I can tell you there is no stone going unturned in terms of trying to really accelerate that program, make sure that we have staff in Kabul, and we do, to conduct the interviews that are needed before people are allowed to receive a visa and leave. So I can assure you there is the highest level interest, both at the State Department, Secretary Blinken, and the president himself in the SIVs. At the same time, we're also looking at possible refugee resettlement programs. Now, resettlement's a little bit of a different type of a program because we wouldn't operate it from Kabul, we'd operate it from nearby countries. So that's really going to depend on if people feel they need to leave and then they show up in an adjacent country, which, you know, I presume would be Pakistan or perhaps India. People actually sometimes go to Iran as well, but we can't operate in Iran for a lot of reasons that you know. So we're looking to see what our abilities will be and to really plan for that possibility. And of course, we're looking in the first instance at people that we have an affiliation with. I mean, there could be, you know, tens of thousands of Afghan refugees, as there have been, frankly, for the last probably 40 years. But we'll be looking as a government to those people that worked closely with us to see how we can bring protection to them. So I think more to come on that. I think we'll have to see what the situation in Afghanistan becomes. On the Rohingya, yes, I mean, we've always accepted Rohingya. Rohingya are referred to us by the UN. And so, as you rightly said, for Indonesia, Malaysia, sometimes Thailand will be the bulk of our Rohingya population that have been referred. Rohingya in Bangladesh, of which you rightly say are many, they qualify for third country resettlement, but they're not allowed to be resettled by the government of Bangladesh. So it's not for lack of interest, either by resettlement countries like the United States, and Canada is playing a big role as well, or the UN for that matter. You know, we have been working on this issue for years to see how we can kind of diplomatically talk with the government of Bangladesh around the benefits of resettling some while others are not, because of course resettlement doesn't normally pick up and move an entire population. So it's happened. I mean, the Bhutanese largely, that's what took place. But, you know, with 1 million, I'm not sure that you have the number, I'm not sure I have it. That's not going to be the short-term reality. So we continue to work with the government of Bangladesh very closely. They are not ready yet to accept third country resettlement, but we are very conscious of frankly, the pretty horrible conditions that people live in, and the ability to use what now is a very large program in the United States to provide protection to some of those. So we'll continue to work on that population.
Thank you so much, Larry, for your responses. I'm going to go ahead and turn to Ken. And Ken, the Office of Refugee Resettlement provides resources to serve not only people who are resettled through the U.S. Refugee Admissions Program, but also those that are granted asylum, are survivors of trafficking, are Cuban Haitian entrants. With increasing numbers of asylum seekers at the border, many of whom may actually receive asylum status, how is ORR planning to be able to provide sufficient resources to serve increasing numbers of refugees along with other eligible participants?
Thanks, Sarah. Yeah, no, very good question. And I think certainly we do try to really track sort of certainly estimates. I think we all recognize certainly the asylum seeker, or certainly the asylum backlog is considerable. I think probably close to 1 million in terms of pending applications. But we did, I think, anticipating higher volume, and certainly I know USCIS and EOR are actually putting a lot of resources to be able to review more applications, certainly in next year and through the end of this fiscal year. We do expect to see probably more asylum grants, which would mean additional asylees certainly being eligible for the program. We have included higher estimates in FY 22 and 23 as kind of our overall budget planning to certainly support higher numbers. I think what we haven't seen, and I'll say other states because I think actually Washington does a good job at this from what I can tell, is really connecting those who've been granted asylees to OR services. The rate of connection tends to be probably less than 10%, but we there's been a lot of outreach efforts to try to better connect asylees to our services. We are working with USCIS and hopefully the Department of Justice to provide more information about referrals and how to make those connections for services. And we have been providing certainly locality and zip codes, I know, to the state coordinators so that hopefully there's awareness on where the asylees tend to be resettling and to have some better outreach efforts to connect them to services. So hopefully we will have some things in place to help better connect them, but we do anticipate growing numbers certainly in the coming years as well.
Great, thank you. One question that I think is on all of our minds, Larry, is something that you touched on, but I wonder if you could maybe help us better understand, and that's how the pandemic has disrupted the ability for people to apply for refugee status. What is the current process for people applying for refugee status, and how has it changed during the pandemic?
Well, I think the place to start would be, normally people don't apply. So I think I have to reframe that for you a little bit, because refugees actually rarely have the opportunity to apply for resettlement. They are, I don't know, what's identified, I think was probably the right word, by UNHCR normally. Sometimes they're identified by an NGO and referred directly to us. More often, there might be an NGO working in the field, and I'm thinking of a situation like Ecuador that I visited once, where there was a collection of NGOs who were service providers, and they were working in the women's shelters and other types of social service areas, and they would meet on a regular basis and discuss some of their clients who were refugees. These were Colombian refugees at the time, and to identify them to UNHCR who were still in a precarious situation. So, I'm sorry to give you a little bit of a long-winded answer, but the standard answer, or the standard notion is less than 1% of the world's refugees are ever resettled, which is true. And so what we try to do, I think, as the US government and other governments as well, is work with UNHCR to decide who should that 1% be. Now, we have family reunification programs that work through the resettlement, great. We have the Iraqi program, people who work directly for us, great. But otherwise, what I will say, a random refugee, maybe from Congo or Syria, then we really rely on the UN to decide who is still in a precarious situation. So in Turkey, for example, if you're a Syrian or an Afghan and you're still not making it, it's difficult. The assistance that's been provided, maybe your own family situation, maybe there's a medical need within your family, all of those things that would kind of trigger identifying those people for resettlement. So, what's happening is that UNHCR is continuing to refer people to us through that system. The last administration actually asked us to stop UNHCR referrals because they felt that our pipeline was large enough. And if you looked at the ceiling they set at 15,000, you would probably agree. We had, over 300,000 people in our pipeline. But this administration, when they came in, basically decided that we should again accept referrals from UNHCR. So we have recently given UNHCR quite a bit of money, over $20 million, to staff up overseas to staff a number of their office up that I think, like U.S. resettlement agencies, had seen attrition over the last 4 years, and to really rebuild their capacity to provide referrals. So the front end of this program is wide open in that sense. It's constrained because of COVID. UNHCR officers, our own staff working with refugees is more limited, but it's not zero. And we are also accepting referrals of all nationalities. Again, the last administration restricted the nationalities that could enter the US. So we had restricted the types of referrals that we could receive. We are now 100% open, any nationality, anywhere, anytime. But again, I'm not gonna sugarcoat it. COVID constrains the throughput, but as I think there's more and more vaccine is rolled out, we'll be able to really kind of ramp up, I think, the numbers.
Thank you so much, Larry. I think that really does frame the situation very well, in that people overseas aren't applying for refugee status. It's something that they are referred to the US government for processing, and it usually comes through the United Nations or other avenues. So that really helps. Thank you.
Yeah, and I would just add to that, because it's one of the talking points that we use, and which all of you are welcome to use as well, because when people think about fraud within the US RAP, or they think about security risk, they think that this program can be specifically targeted by somebody who a terrorist who wants to enter the program. Not unless you are randomly selected by UNHCR would that ever work. And so, it's one of the many kind of safety valves, if you will, to make sure that this program has integrity. And I think it's a great thing for local leaders to understand, because otherwise they think people are able to choose. They're not. If UNHCR selects you for resettlement, you could go to Canada, you could go to the UK, you could go to Australia, you could go here. There's like 15 different countries you could go to. Thanks.
Thanks, Larry. Are there any other questions from the audience? And if not, I do see Nicole, I think this is Nikki Smith from IRC.
It is Nikki Smith. Thank you very much, Sarah. I have a question for PRM, as well as ORR. We've talked about the impact of COVID internationally, but we also have a significant impact here in the US, less about the population now, thankfully, but more about the infrastructure and how that's being overwhelmed by, COVID vaccines for the general public. And that's going to essentially have an impact. And we've got a great team here, but they're going to struggle to meet the requirements of having a health check within the first 30 days, and maybe even in the first 90 days, because of the infrastructure overload. And so rather than, because we all want to be compliant to our agreement, but I was wondering if we can have some kind of waiver where it's necessary about that issue, rather than having to consult on every case that doesn't meet that 90-day with Sarah and with Jasmine, more importantly, Jasmine, so that we get a letter in the file, because that's going to be a huge amount of paperwork, which is going to add to the burden of the state as well. So, I think I would like to have some conversations, if possible, about how we can analyze the infrastructure overload here and what impact that will have on arrivals, so that we can be compliant but not overly bureaucratic at the same time. So perhaps some forward gaze, thinking and planning on that. Thank you.
That's a great question. And I promise you, Larry, Jasmine and I did not ask, Nikki did not prepare her to ask that question, but it is a good one.
I'm thinking about my paperwork as well, Sarah, having to follow everyone in my team to do this as well. So it's a mutual question.
No, the more I heard it, I thought, sounds like Sarah's overly bureaucratic, and she needs to figure out how to make your life easier. So
yeah, that's crazy, isn't it? Federal government, help us out, be less bureaucratic.
We will totally be receptive. I know Kira's on this call, listening, taking notes and taking names and finding out who's complaining about our structures. That's a joke, by the way. So we will work with you. Listen, we are not. I actually happen to be in the office today, so this is not my house. Although it would be nice if it was, I suppose. But for the look, I think Ken's at home. I'm pretty sure I recognize his backdrop. So we're all still working under very difficult COVID protocols, and we get that you are too. So come back to us on that. We'll reach back to you. We'll figure out how to make this work. And at the end of the day, we want the same thing. We want refugees to get the services that they need to succeed, and we'll find a way to make that happen, and also kind of do our own due diligence around our financing and kind of other responsibilities that we have to carry out.
Thank you. I do see we have another question, but unfortunately at this point in time, we have to move on. I do want to thank Larry and Ken and all of our partners at the Department of State and the Federal Office of Refugee Resettlement. We have seen and felt the response to the pandemic, both in the finances provided through the RMP program and the RSS extra funding that we received that helped us to provide emergency support services and access to technology and the additional waivers. So we have felt that the federal government has heard us through this process. And so we really respect and appreciate your partnership. And we're just so grateful for your time and attention today. We know how busy you are in building back better the refugee resettlement program. So let's all virtually give Ken and Larry a round of applause. Thank you so much for your time today. You are welcome to stay with us as we move throughout our program.
Yeah, and thank you for having us. It's really enjoyable.
Yeah, thank you so much, Sarah. And thank you all. Thanks for all you do. Thank you.
Great. Thank you so much. So we are now going to move on to talk about the state perspective. And I'm going to see if I can share my slides again. All right. And I think that we have Jason watching the chat box for any questions. Thank you, Jason. And I'm going to just go ahead and dive in. So this is the time that Jasmine Matheson, our Washington State Refugee Health Coordinator, and I are going to talk about how we're going to grow and support refugee resettlement in Washington. Washington State has a long history of being a welcoming place for refugees. Being a welcoming place is a collective effort that takes time, commitment, and dedication of many organizations, employees, volunteers, and community members. The success of resettling refugees in Washington is due in large part to all of you who are joining us today in this virtual public forum. So thank you. Thank you for all of the hard work that you have done over many years in making Washington a welcoming place. The Washington Office of Refugee and Immigrant Assistance envisions our state as a place where refugees and immigrants thrive, lead healthy lives, and contribute to their communities. We support this vision by coordinating and providing resources for the services that help people succeed. Annually, ORIA invests $25 to $30 million of state and federal funding into local communities. We partner with more than 70 different community-based organizations and other partners who offer services focused on refugee health and wellness, employment and training, immigration assistance and naturalization services, and whole family programs. Our whole family programs focus on kids in school, youth mentoring, and older adults. During the pandemic, the ORIA team has been really focused on how we can better help support our communities. We have created an emergency support services program, in part with funding from the Federal Office of Refugee Resettlement, and our new technology access and digital inclusion program, supported by Jennifer Malloy and members of our ORIA program managers, to help people be able to access technology and digital inclusion. While today's conversation is focused on rebuilding our community's ability to welcome more refugees and more asylees through the formal refugee admissions program, it is important to note that the programs and services provided through the Office of Refugee and Immigrant Assistance serve a broader community. Our state and federal funding allows us to serve people with diverse immigration statuses, including people who have been granted asylum, Cuban Haitian entrants, unaccompanied refugee minors, certified victims of trafficking. And in 2020, a bill passed in the Washington State Legislature that will extend our state-funded benefits to allow certain victims of trafficking who are in the process of applying be able to access cash and food and medical assistance, and they will also be able to access our employment and training programs. As we talk about increasing the number of people arriving each year in Washington, our work is also to provide resources and supports to people living in our communities as they work to rebuild their lives. In 2020, for example, our services reached nearly 11,000 people. And at the same time, about just under 2,000 people, or 1,768 people, arrived through the US refugee program. So you can see that we do serve people for longer periods of time during their resettlement journey. From 2014 to 2020, Washington resettled an average of 2,889 refugees and special immigrant visa holders every year, and for a total of over 20,000 people. As you can see on this chart, the past 4 years, Washington has had lower arrivals. We saw a 55% reduction from 2017 to 2020. In addition, over the past 5 years, Washington has had over 3,200 people be granted asylum and over 150 victims of trafficking and Cuban Haitian entrants. This year, we've had the lowest number of refugee arrivals in the United States at 2,334 refugees and 2,237 SIVs from October 1st of 2020 through April 30th of 2021. This has resulted in significantly lower numbers for Washington, with only 380 people in the past year. As you heard earlier, these low numbers are due primarily to the impact of the pandemic internationally and on the United States government's ability to administer the program overseas. On May 5th, President Biden signed a new presidential determination raising the ceiling for refugee arrivals from 15,000 to 62,500. While this is very much an aspirational numbers, our federal partners have shared that nationally we are likely to reach 14,000 to 20,000 refugees this year. What does this mean for Washington? While it is difficult to predict, we can anticipate arrivals to increase, especially in July, August, and September of this year. National resettlement agencies are currently working on submitting proposals to PRM for the reception and placement program, and many of them are focusing on numbers to reach 65,000 to 125,000 for federal fiscal year FY 2022 and FY 2023. In Washington, we currently have 8 refugee resettlement agencies that resettle refugees in 5 core areas across the state, including the Puget Sound region, which includes King, Pierce, and Snohomish counties, Clark County, Benton Franklin counties, and Spokane counties. We have received proposals to open 2 new offices in FY 2022. IRC is proposing to resettle refugees in Spokane, and World Relief is proposing to open a satellite office in Bellingham in Whatcom County. Today, as we hear from the refugee resettlement agencies and we enter into conversations about how to support the growth of arrivals, it may be helpful to consider some projections. This chart compares the number of refugee and SIV arrivals in each geographic region from 2016 to 2021. Using information from the refugee resettlement agencies, we tried to predict the growth, what that growth could look like for the remaining 2021, 2022, and 2023. We're hoping for incremental growth on the national level of welcoming 14,000 refugees for the rest of 2021, 65,000 refugees in 2022, and 125,000 refugees in 2023. Over the years, Washington has welcomed anywhere from 4 to 6% of the total number of refugee arrivals. The numbers here reflect refugee and SIV arrivals. And while we look forward to moving towards fulfilling our nation's commitment to addressing the global refugee crisis, Washington seeks to use this time to be mindful about our growth. We want to ensure that every individual and family arriving has the resources they need to thrive. And this is particularly important as we consider the diversity of our communities. As we welcome more diverse groups of people, how do we prepare to ensure that refugees receive the services they need in their native languages? How do we support culturally responsive services that are also trauma-informed? These are the questions that we explore with you as we seek to support a growing number of refugee and SIV arrivals. We welcome you to join us today in our discussion and in our commitment to making Washington a welcoming place in 2021 and for many more years to come. I'm going to go ahead and stop sharing my screen, and I want to thank you so much for your attention. And I'm going to ask Jasmine Matheson to go ahead and join us and share her thoughts on how we can continue to build refugee resettlement in Washington State, especially as it relates to the pandemic. Thank you.
Thanks, Sarah. Can I just confirm you can see my screen okay?
We can see your screen and we can hear it as well, hear you as well.
Very good. So I'm going to try and cram a lot into a short time period, but I am really happy to take questions afterwards and respond via email. So I'm going to talk a little bit about refugee health screening, touching on the points that Nikki so nicely laid out for us, the COVID-19 updates for our state as that continues to impact our conversation about refugee resettlement, and then some community actions around COVID-19 vaccination specifically. Sorry, there we go. All right, so just to frame our conversation, I mean, public health is not an individual exercise ever. It's really grounded in our communities. So when we talk about health in our state and rebuilding, we focus not just on what's going to happen in an individual health screening visit or an individual doctor's office, but really we're talking about the big picture systems, experiences, factors that allow people to be truly healthy and successful as they resettle here in Washington State. And this is built on partnerships between refugee communities, resettlement agencies, health departments, primary care, clinical networks, and many others. And this is the lens with which we're approaching rebuilding and expansion. So refugees receive a health screening examination after arrival at one of 7 clinics around our state, and this typically happens within the first 30 to 90 days after arrival in the US. COVID has obviously impacted the timeline for refugee health screening multiple times over the course of the pandemic, and our clients, clinics, and partners have continued to be incredibly flexible throughout this process. The timeline that's shown here is an estimate based upon the updated CDC guidance, which came out last week. And it incorporates offering COVID-19 vaccination into the refugee health screening examination. This is an incredibly important update, and our clinics are working hard to make this change, and they're eager to give every client the opportunity to receive this protection as soon as possible after arrival. So while our typical goal for completing health screening is 30 days after arrival, at present, you can see with the timeline around quarantine and receiving 2 doses of COVID vaccine, it's actually not possible to complete a refugee health screening examination within that defined timeline. With anticipated increases in arrivals and potential surges, we do anticipate that we will see delays in health screenings as we increase our arrivals and our capacity. So I'm going to shift gears and do some quick COVID-19 updates. This slide shows our epidemiologic curve for COVID-19 cases in our state. We've had over 390,000 cases in Washington State. So over time, you can see on the right-hand side, you can see the line is tipping downwards at this point. And the most recent update from our epidemiology team is that the case counts are declining statewide. So getting vaccinated is protecting people from serious illness from COVID-19, particularly illness requiring hospitalization. The hospital admission rate for COVID-19 in unvaccinated people ages 45 to 64 is about 18 times higher than the hospitalization rate for people of the same age who are fully vaccinated. So it's really wonderful to see the impact of the vaccine on those severe outcomes. We're really excited to see the trends improving around COVID-19, but we're definitely not out of the woods yet. We still have a lot of work to do around vaccinations if we want to continue to see these declines in disease and make progress towards full reopening. Getting vaccinated remains the best way to protect yourself, your family, and your community from the virus. At our last RAC meeting, we talked a lot about different eligibility categories and prioritization around COVID-19 vaccine. I'm very happy to say that it is very simple now in terms of eligibility. So as of May 13th, everyone ages 12 and older is eligible for the COVID-19 vaccine in Washington state. These dials show progress towards the population level vaccine uptake. And as of May 17th, 48% of residents were partially vaccinated and 38% were fully vaccinated. We are working together towards a goal of a 70% or higher vaccination coverage. So I wanted to share a little bit with you about the refugee immunization evaluation work that has been ongoing in our office. And Washington State has actually done immunization evaluation work with refugee health screening clinics for many years. And we had the opportunity to add COVID-19 vaccination into this evaluation. We recognize there's limited community level COVID-19 vaccine uptake data, and having refugee specific information and evaluation can provide one lens into how our recent arrivals are navigating and accessing the healthcare system as well as this resource. So we recognize that there are many potential barriers to immunization, some of which are listed here, and these can really impact somebody's ability and the conversation about their choice to get vaccinated. When we see lower rates of vaccination coverage, there can be a lot of different factors. It's important that we continue to listen and respectfully understand these factors and have these conversations with friends, with family, with community. So some of the things that could be impacting folks include social, cultural, and religious beliefs, practices, a need for more information, lack of digital access, and transportation access are just a few. So the immunization evaluation has a couple objectives, and the first one is really to describe the trends in COVID-19 vaccination. And to ultimately, the point of doing these sorts of evaluations analysis is to help inform and support existing efforts and future needs for refugee communities and to address health disparities. I won't go into the method slides too much, but did want to just note that the data I'm going to share is specific to newer arriving refugee communities for arrivals from 2012 through January of 2021, and that the data was pulled from our immunization registry as of May 11th. So we'll continue to update this, and this is preliminary data that we're sharing in order to help inform outreach efforts. So this slide looks at the initiation of COVID-19 vaccination by age group. The yellow bar shows the proportion of refugees who have initiated COVID-19 vaccination, and the gray bar is the general Washington state population. So compared with the Washington population, refugee vaccine uptake is lower across all age groups as of our data on May 10th. It's also worth noting that those in the younger age groups have only become eligible for COVID-19 vaccination more recently, so we see lower uptake across the board in those groups. This slide shows the top 10 countries of origin during this period, and the percentage of people ages 16 years to 64 years of age who have initiated COVID-19 vaccination in Washington state. So the intention with sharing this data is to have information that allows us to sometimes make smaller communities more visible. It isn't always possible when we look at big race ethnicity numbers, and we have had ongoing community requests to help inform community-led work and investment and understand where need areas are. We do see variation in COVID-19 vaccination uptake among different communities, ranging from 2% among clients from Ukraine, Russia, and Moldova, up to 51% in clients from Iran. Community leaders and organizations across Washington have partnered throughout the pandemic to share information, resources, health education. The Somali Health Board, the Afghan Health Initiative, Congolese Integration Network, Islamic Community of Tri-Cities, the Iraqi Arab Health Board are all just a few. And I know that there are many organizations on the line today and individuals who've been supporting this work very actively. We all have more work to do together to ensure that newly arriving refugee communities have the information they need about COVID-19 vaccine and access to the vaccination. And we look forward to continuing to partner with you all in this work. All right, finally, I just wanted to share a few actions that are being taken currently around COVID-19 vaccination. Washington State's response has intentionally prioritized and centered communities disproportionately impacted by COVID-19, particularly throughout the community engagement efforts. So there has been funding for culturally responsive COVID-19 outreach and education to BIPOC, refugee, and immigrant, limited English proficiency, and disability communities. In 2020, there was investment in 41 community-rooted entities. Currently, there are 27 community and ethnic media outlets and community-based organizations that are carrying out community-driven messaging. With the current investments that we have, we reach 41 different language groups and 47 different communities in Washington State. There are plans for another $1 million of investment between now and June 2021 with an additional 45 outlets and organizations. In addition, DOH has created a COVID-19 vaccine implementation collaborative, which is a bi-monthly meeting between DOH and community partners to inform best practices for vaccine implementation and to learn how to reduce barriers. We've also been working in partnership with communities from the former Soviet Union, and that team continues to work on resources both for community and for healthcare providers. So there's a lot of information out there about COVID-19 vaccine. These next resources are just examples and links, and we're happy to share them after the fact to connect folks to different resources. But one of the ways that we wanted to note is that with so much information floating around, having trusted resources and having information coming from trusted sources is critical. There are translated resources available at all of these sites. And I know many of our community-based organization partners have been doing a fantastic job in providing culturally and linguistically appropriate services and health promotion information. If you happen to see a topic or a language that is missing, please feel free to reach out and we would be happy to work to address that. Information sessions have been another critical tool throughout the pandemic, and COVID-19 vaccine is no different. I know many CBOs are doing this regularly in a variety of different languages. Public health and many clinics have also been partnering to host meetings for communities to ensure that people have the opportunity to have their questions answered. And we're happy to set up a time to do this if that is ever helpful to you, staff, clients, or community members. The National Resource Center for Refugees, Immigrants, and Migrants has been hosting webinars with information on a variety of topics. And I did want to highlight one of the practical approaches for discussing COVID-19 vaccination with clients or family as a really good resource that I know was shared just this past week. DOH has also shared information on ways to address vaccine hesitancy with loved ones. We also have some community conversation guides in development. So the CDC has one on their website currently. DOH has work ongoing at the moment to develop a guide specifically for partners who work with refugee and immigrant communities to help guide some conversations about vaccination. So helping make appointments, the vaccine locator tool is available in 37 different languages and is on our site here. The red box on the right-hand side with a little globe is where you click if you want the site in a language other than English. Sorry, I know I'm going a little bit quickly, but I'm getting conscious of time here. I did want to just highlight two more things, that our vaccine helpline is another way to make an appointment for folks who don't have access digitally or who prefer to talk it through with somebody. Language assistance is available and they are open a wide variety of hours. And the vaccine helpline has the option to help people both book appointments as well as figure out transportation needs. So Uber and Lyft have partnered to provide free rides to vaccination appointments, and those can be scheduled through the Vax helpline. Apple Health Medicaid also has funded transportation to appointments, and Spokane Transit just recently announced that they're providing free transit door-to-door shuttle service for vaccination appointments for a month. The last thing is that the DOH is in the process of transitioning. Previously, we've had large state-led mass vaccination clinics as a way to get high numbers of folks vaccinated. But as we shift, we're shifting strategies, and the new phase of vaccine outreach is really helping the state reach folks who have experienced barriers in vaccine access. And so we're moving to more mobile clinic-based options to help distribute shots more equitably and conveniently across the state. So if your organization is interested in potentially hosting a pop-up clinic or partnering to do so, please feel free to reach out and we would be very happy to help connect you. So just to wrap up, our COVID-19 vaccines are safe, they're effective, they protect both you and our community. And I want to really thank you all so much for the work that you have done to help support our communities to get vaccinated. Please do feel free to reach out if our team can help support you all at all. Thanks, Sarah.
Jasmine, thank you so much. We really appreciate all of your information and the wonderful advocacy and resources that you provide to our refugee and immigrant communities. This has been a really particularly challenging time, so we acknowledge the tremendous support that the Department of Health has offered. All right, at this point in time, we're actually going to transition to our panel with all of representatives from all 8 of our refugee resettlement agencies. And I'm going to go ahead and turn it over to Momar. Momar, are you on the call and available?
Yes.
There you are.
Good morning, Sarah and everyone. And thank you for this great forum and meeting today, and lots of great information and resources we have been hearing from the Department of State, from the PRM and from RR. And yeah, thank you for all our partners and providers and community joining us today. So my name is Momar Abugela. I am one of the Washington State Refugee Advisory Council member, and I would like to take this the next 30 minutes and to have a discussion, and we have some questions that's being brought by across Washington State by my colleagues from Refugee Advisory Council members, and to have this question being asked to refugee resettlement agencies in Washington State. So we are joined by a representative from each of the 8 refugee resettlement agencies in Washington State. Today, we would like to spend 30 minutes asking them questions about growing and expanding refugee resettlement in our local communities. So with the great news for this year, and with the new administration increasing the numbers of arrival, there is a lots of energy and excitement from the community, the existing one and the new one who's coming forward and asking questions. So there were several questions. We chose 5 of them, and we would like to address these questions. If there is any other questions that you might have during our conversation, I'll invite you to drop your question on the chat box, and we'll be happy to follow up with any to address them. And without further ado, I would love to invite all my colleagues from other resettlement agency to introduce themselves.
Hi, everyone. I'm Mindy Johnston from Lutheran Community Services in Vancouver, Washington.
Greg Hope from the Diocese of Olympia, located in Seattle, but our office is in Auburn, and we're part of the Episcopal Migration Ministry resettlement system.
Hi, I'm Nikki Smith. I'm the Executive Director here in Seattle, or CTAC, and hopefully soon for Spokane. So I will then become Washington State Executive Director. So hi, everybody.
Hey, everyone. I'm Jordan from World Relief in Spokane.
I am Margarita from Parties and Careers in Clark County, Vancouver, Washington.
Hello, everyone. I'm Medan Gaita with World Relief Seattle.
Hi, everyone. I'm Cordelia Revels with Jewish Family Service, the highest affiliate in the Seattle area.
Great. Thank you, everyone. Thank you for your time and for joining us today. I will go ahead and start with the questions and we have. So the first question, Mindy, it's how do resettlement agencies do community engagement?
Hi, everyone. Yeah, so I'm sure there are lots of different ways that we all go about this. For us in Vancouver, we really start with the communities that are reaching out and expressing interest in order to get engaged with refugee resettlement. There's a lot of just community members at large who want to get involved and want to mentor or do donations. We try to connect a lot with our different faith communities in the county. We use social media. So we're always, we are also responsible here for our quarterly consultation. We call it our Refugee Community Forum. So that's a realm where we'll invite people to those meetings. And, we have, I think because we're the only ones, maybe it's a little smaller, I don't know. But that's a great place to kind of plug people in. We actively try to connect with our city leaders, our city council, our mayor, and they're very supportive. So I'm assuming this is probably pretty similar across the state to how the different regions are reaching out. And, I think we first try to get the lowest hanging fruit in terms of people who are interested. And then we are always engaging and actively trying to educate the community about what refugee resettlement looks like in our state.
Very great, thank you, Mindy. Indeed, it's a community engagement. Yeah, it is. It's a lot of effort and work, and you have to, it requires, community engagement from different levels, private and public, and using all different medias, and especially with, it's really part of support that you're looking for is community engagement for resettling refugees in our area and make them feel home. The next question is, that's for Jordan. What are some of the factors that are part of the process in considering how many refugee arrivals are proposed for a given community?
All right, that's me. So there are a lot of factors. Starts with that community consultation. So not only are we talking to our state refugee coordinator and health coordinators, but we're also talking to all the local people, local government. We have a really good relationship here in Spokane with our city government and mayor. We're talking to public schools and health and safety. So police and sheriff and fire department, also the school districts. So that I'm kind of getting everyone's input in that. And then also other factors that are important are housing, which we're going to talk about a little bit. Is there available housing? What's the cost of living? Spokane generally has had great cost of living compared to the rest of the city, but rents have gone up, availability has gone down. So that all goes into factors, and also jobs. Right now, there's tons of jobs available. So that's another factor that goes into determining how many new people we can welcome.
Great, thank you, Jordan. I would like to have Greg. Would you like to add on what Jordan?
Okay. I think I'll just add, a more narrow perspective, just what maybe my thinking process is when I'm deciding, when somebody says, come up with the numbers that you resettled this year, and as I've been going through this webinar, I think how there's some unconscious things that you just feel secure about, so that you don't worry. And one of them is the state's commitment to jobs and ESL and the Prime program, that it helps us. I mean, we feel, I think, pretty secure that people may not have a social security card when they first arrive because of various bureaucratic things, but we've all got job developers who can pretty much immediately begin working with somebody. So that's helpful. Some of us have ESL teachers that can, make families feel secure, like there's something going on with, English language learning, which is going to be a priority for them. And then we have the PRIME program to help people after the 30-day or 90-day resettlement period to, kind of hang in there and provide some intensive case management. So these things maybe go unthought of in your decision-making process, or at least in the background. And then you have to look to the things you've been able to generate. Some unrestricted funds, or maybe some government funds for rent supplements. It's never going to be inevitable. How you feel about housing. Maybe you got some landlords that are kind of looking up and making it easier for you to, place refugees in apartments, or is it a big struggle at the moment? And that kind of, for me at least, goes up and down. There's some moments where it just seems like, wow, this is going to be a big hurdle. I don't know about this. And then others, right now, at least just cautiously hopeful. And then I think there's kind of intangible things, like what's just happening with volunteers. You're getting a lot of people interested, and I think now there's some things happening with us where we're there's a group that wants to come along and help sponsor a refugee family, and they all want to donate their stimulus checks, and they're kind of bundled around that. So I think, wow, that's cool, and makes you feel like upbeat. And then some odd things like that also just demonstrate public interest. There's a Ukrainian church that's approached us because they want some help with a family, and I don't think everybody in the family, at least the husband and wife showed up, family of 9, and the husband and wife have ankle bracelets because they're, they crossed the Mexican border and they got to get to some hearing, coming up. And this, church wants to looking toward us for some help. And I think that bodes well for the future. And just getting who's going to help you with the coming, refugee, I don't want to say deluge, but increasing numbers. And I think it's time to be a bit hopeful. Anyway, that's what I have to say.
Great. Thank you, Greg. Indeed, it's a lots of work and a lots of investment in the community and outreach to make sure, that the people, the number, how many we will be able to resettle, and making sure that we have all the resources and all the support needed. And yes, one of them, faith community groups, that is one of the biggest, support that, and a big factor also that's working to engage refugees and integrate them to the community as well. Thank you, Greg. They say it takes a village to resettle refugees or family, and it's a lots of work. And the question I have, and that's for Cordelia, it is, we know that resources are often hard to find for people after they have been in the United States for a longer period of time. How will your organization make sure that people get connected to supporters for a long period of time?
Yeah, that's a really great question. I'll just kind of continue to add on to what Greg was saying. It's really a critical component of our work as resettlement agencies to make sure that the families we work with are connected with various forms of support after their resettlement period. I don't think anyone who works in resettlement actually thinks that the formal 90-day period is everything that a family needs to be supported in the community. And so all of us work to make sure that families have support after that official resettlement period ends. That can look like, in-house programs. So as Greg mentioned, some of us have programming funded through the state with partnerships with ORIA, whether that be the PRIME intensive case management program or employment services. It can be other federal programs, such as the Preferred Communities intensive case management programs. But an important part of the work is also connecting clients to resources outside of our agencies. And so that's where all of you as community partners and stakeholders come in. And so, there's a variety of supports through the school districts, through community-based organizations, and it's really essential that families are connected to those resources at the end of their resettlement period so that they're not kind of left on a cliff at their 90th day with no support in the community. And I will also hand it over to Amira, I think, from World Relief in the Tri-Cities, if she'd like to add anything.
Hi, everyone. Amira Al-Salami from Tri-Cities. Thank you, Cordelia. We are lucky in the Tri-Cities. We have the support of churches and the Islamic Center, the school districts, especially Kanawuk School District. And I can see here Pam Hanuger from the Family Learning Center, and so many facilities which support World Relief. So we have programs beyond the first 3 months. As you know, there is Prime program, there is a Preferred Communities program, and there is the ESS from the state funding, a lot of programs. But I wish that we could have programs for people who are more than 5 years here. I know programs are limited to 5 years, but believe me, there are areas that our refugees still need to be empowered with beyond the 5 years. So I hope that this wish becomes true. Thank you.
Thank you, Amira, and thank you, Cordelia. Indeed, it's a lot. It is a lot of supports that we, as we have in Washington State, but we are still looking for. And indeed, it is people usually doesn't take even 90 days or 1 year or 5 years sometimes for refugee to get integrated and be part of the community. We are just amazed by the support we are seeing, and every day and every year and every time we have more refugee and more community, they are coming up where there is no refugees in that community, then coming up, but they are asking how they can help, to support and bring refugees to their home. So as we are, always challenging to, there are so many challenges to resettle refugees, and one of the challenges that is not only local or Washington State, is nationwide, is finding affordable and safe housing for refugees. So the United States is facing a housing crisis, and finding safe, healthy and affordable housing is a significant challenge. And I would like to invite Nikki, the Executive Director for IRC, for this question. So what are the tools and practices would your resettlement agency be using to help address this issue?
Thank you for that question, Muammar. I feel like after answering that question, I can answer the world peace issue, because I think both of them are fairly intractable. But I'm an eternal optimist, and the housing question is a nationwide issue. It is something that is being asked in every single city or town wherever resettlement is being done through these consultations. So IRC has an approach, has a very specific approach on how to find safe, healthy and affordable housing. I'm going to speak about our approach in Seattle, or King County, Pierce and Snohomish, and then this is something that we would like to replicate in Spokane if we were to be approved to open there. So our approach to finding the housing primarily centers on building and maintaining relationships with property owners. I mean, we found property owners and managers in the area. We found that, having that relationship established is really important. The other thing we found out that finding 1- and 2-bedroom apartments that meet the IRC and PRM standards is actually a lot easier than finding 3- and 4-bedrooms. And recently we found a 5-bedroom apartment, so we're like, we're done. That was like, the miracle of the year. But the 3- and 4-bedroom apartments really do pose significant challenges, and we've typically found that tax credit properties are the only real environment that allows us to have the affordable, safe, emphasis on affordable at that size in these high property movement areas. But those take 2 to 4 weeks to process, and the families have to actually be in the country. We can't do this before they arrive in the country. So that's an issue, right? Because, well, what does the family do for 2 to 4 weeks whilst you're figuring out the paperwork and getting them all signed up for that. And that's where some of the relationships that we've established through Airbnb and other environments has allowed us to put families into temporary housing whilst we complete the paperwork, with the notion that it's a short-term pain in temporary housing so that they can be in an affordable property that, as Cordelia has mentioned, can go beyond the 90 days, that they can manage it after the 90 days after the intensive support. So we found that having a dedicated and experienced staff, and this is the thing, we actually have a dedicated housing team, has also allowed us to maintain those relationships. It diminishes competitiveness amongst the caseworkers, and that we have a primary point of contact as a relationship manager with those property managers and property owners, so that we can resolve issues in a timely manner and maintain working knowledge of apartments and contacts and their internal processes. So that's on the supply side of things. We're also working very heavily on the demand side of things. That's the demand. We're also working on the supply, because I think that's a really important area, which is, there is a critical issue of supply. And we have to look at this at not just the localized level, but really the macro level, right? What is the government would like to bring in more refugees. That is wonderful. We all love that. But how is the communities going to support them without more affordable housing? And we have to look at this in a responsible manner. And we can't just put the issue at the local level and ask them to resolve it. The federal government has to support this as well as the state government. And so working on the advocacy side of things, whether that's in DC or whether that's in Olympia, working in consortiums with housing consortiums, or low-income housing consortiums, or working together as a collective with partner resettlement agencies, means that we have a stronger voice, and we can get beyond the notion that we're just complaining, but really saying this is a really important issue, and we need to work on this, not just for now, but also for FY23 when we're having increased numbers. So we actually have to work very carefully on the demand side of things so that we're ready. It will give us a few years to get ready for fiscal year 23 when we're having this massive larger number coming in. So those are just some thoughts about the housing, Muamar.
Wonderful. Thank you, Nikki. It is a lot of work, really, and it's required collaboration in many levels. Yes, state, locally, government level, and community support. I would like to add one of the things is, looking for temporary housing is, reaching out to volunteer and community support for, like hosting families. If we have, some houses where families can, be supported by the volunteer who want to help them. So there are so many, many forth. And I really appreciate Washington State and Office of Refugee and Immigrant Assistance that is throughout the King County Housing Task Force. We are looking to, have this more coalition expanding across the Washington State to have the task force and see where and how this housing challenge can be tackled down, and we'll be able to resettle more family. Thank you so much. As with these challenges about refugee resettlement and and how we meet their needs, COVID-19 pandemic brought also a big challenge, and we've seen this challenges started with first that we haven't seen the number of refugees that were expected. There was a low, big drop in the numbers of the refugee, and then the one who's arriving here, how we can support them throughout during the pandemic, and now as the vaccination effort that's going on. The question is, and that's Medard, it is about what is your service delivery plan after the pandemic? What's the World Relief doing for what's the delivery plan, and will you be able to provide service in person or mostly remotely?
Great, thank you, Muhammad, for the question. And I think the straightforward answer after the pandemic would be to reopen, of course, and being able to serve our clients, our participants. One of the things that we learned through this pandemic is that is the value of human interaction and human connection, which has been lost while we shifted into providing services remotely. And so for our newly arrived families and participants, as they are trying to navigate their new lives and understanding the system in America and things, it is more valuable when we can provide services to them in person rather than remotely, because remotely comes with other challenges that we know, right? Access to technology, but also usage of technology as well. But in the meantime, we also did learn something great during providing services remotely. ESL class, for instance, in our case, we were able to have a greater accessibility because when we were providing classes in person, some of the families, due to childcare issues and challenges, couldn't always make it to the classes. And now that we're doing it remotely, we've been seeing many people participating in the English classes. So it works great for some people, but also it's a challenge for others. And so with the increased number of people getting vaccination and following the guidance from the CDC as well as the OSHA, we're really hoping that soon here we will be reopening and being able to serve people in person, while some of the things can also be provided remotely to give possibilities and access to some of the families who may have challenges related to things like childcare, like I mentioned earlier. So we're looking into reopening, but also the flexibility of providing some of the things remotely for some families as well.
Wonderful. Thank you, Medard. Yes, really, it is. It's really so inspiring, the creative ways how, also how we, come up to deliver, services to, refugees remotely, and to make, making sure, that the service delivered safely, and also and assure that they received, the service. It has been a great work from resettlement agencies and from, all the providers, to ease the barriers. And this is great to hear what's your organization doing. I'm sure there'll be more questions, and so if there is any more, so we still have 1 more minute left. If there is any questions to the refugee resettlement representative here from the community.
Jason, do you want to go ahead and ask one question?
Excuse me. The one question that's in the chat is about what's going to happen with new refugees in terms of access to COVID vaccine through public health providers. That's the only question right now in the chat.
Yeah, I think it's a good question. So, and maybe we can invite Jasmine to answer too, if needed. So it's Soon's question is, for upcoming new arrivals, will resettlement agencies plan to educate and provide information available about the COVID-19 vaccine opportunity? And will you work with the local public health or providers to accept vaccines when offered?
I can start, and I feel like many of our agencies are already really partnering in this work already and starting to host clinics, provide information, have had their staff had training and information too. So I think we're really interested in making sure we have consistent, accurate messages available to clients and trusted sources. So absolutely want to partner with the resettlement agencies and continue to do so. But maybe folks could share a little bit about some of the things you guys have done already.
Would anyone like to add anything? It's been a great work has been going across all the resettlement agency, and that's how just.
Yeah, and I think
I can share briefly that yes and yes to this question. We in Vancouver, as part of our cultural orientation, talk about COVID and vaccinations. We have materials in the appropriate language. So yes, and I think this is also happening overseas, the sort of COVID vaccine orientation. So they're getting it before they travel and then when they arrive.
We do the same thing at Tri-Cities. We do education through our CO and through Preferred Communities program. And once there was an activity for the Islamic Center where a community survey was done in advance, and then they hosted a doctor and he answered all the questions. So it is something like systematic. So we put it like questions and answers, and it's so easy to deliver.
Wonderful. Thanks, Amira. Sorry, we are running out of time, and I would like to thank you all for your time, and thank you for your all what you're doing. It has been just an honor and pleasure as one of your colleague about working together in this very challenging time. So thanks again, and with that I will turn it to you, Sarah.
Excellent. Thank you so much, Momar. And let's all give Momar a round of applause for a terrific job of facilitating our panel today of the refugee resettlement agencies. Momar himself is a director of one of our 8 refugee resettlement agencies in Lutheran Community Services Northwest in Pierce County. So thank you so much, Momar. We really appreciate all that you do, and for you volunteering to facilitate this conversation. All
Thank
right.
you, Sarah. It's always a pleasure.
So now it's your turn. All of you are invited to join us in having in doing some community listening sessions. We really want to hear from our community partners around what will it take for us to continue to grow and expand the number of refugee and SIV arrivals in Washington state. And we've asked each of our Refugee Advisory Council members to join us in a breakout session. And we have a facilitator and a note taker or a reporter for each room. And we'll be breaking you out into about 6 different rooms. And we're going to ask questions that are really just designed to guide a conversation. And we're looking for your feedback from your perspective. Some of the questions that we'll be asking will be focused on identifying what resources are available and what resources are needed. We'll talk about how do we ensure that people have their basic needs met through food security, childcare, safe and healthy affordable housing and jobs. And how do you address education and employment and training issues, making sure that people are thriving in our communities as they go to school, find careers, and really identify their best and most living wage professions. And are there areas that we've missed? Are we asking all of the right questions, or are there things that we should be asking? So I think, Hamid, now is a great time for us to go ahead and begin to do the breakouts.
Yes, sir. Thank you. It may take up to 1 minute for our facilitators and reporters to join. Thanks for your patience. Folks, you can select to join the rooms you want. And we open the breakout rooms.
It might be helpful to note that you actually have the choice to join a room. So you'll see a white box on your screen and that says breakout rooms. And if you go down, you'll see that there are breakout room 1 through 6. And on the right-hand side, there's a place where it says join. So feel free to go ahead and assign yourself to a room to participate in. So on your screen, you should be able to see a little white box, and it should just say breakout rooms in progress. If it doesn't, just choose join breakout rooms at the bottom, and then you should be able to choose a room.
If you join through the phone number, I'm going to assign you to one of the breakout rooms. If you're not able to select, thank you. So they want me to stay in the main room? We all joined.
You can, okay, yeah, it looks good. I don't think it matters. If you want to join, you can.
Okay.
I think I'll try to join a room too.
I will join a small room number 6. Nobody joined, only one person. Okay. Abdul Rahman is there.
Oh no, that looks like there's
Oh, there
several
are
people there.
Yeah.
Yeah.
Okay, I see. Yeah, I'm going down. Yeah, you see. You're right. So we're good.
Okay, I'll join. I'm going to join them each. So I'll join number 1 to start with.
Okay. I will stay in room 2, Sarah, if you need me.
Okay.
And how long you want it, Sarah? 40 minutes?
Let's do until 12:15.
Okay, 36 minutes. Okay.
Yeah, just do till like, yeah, just do 30 minutes. I think is fine.
And okay, thank you.
Jordan, and there is another part for that, and it said, what are the resources needed still you think you needed in Spokane?
I would say really what's needed is more housing. We look at housing kind of in 3 parts. There's the initial temporary. So we're reaching out to host homes, or could be Airbnb, hotels, kind of all that initial like temporary places. And then there's like the first permanent place where a family might stay for a year or a couple of years, or
yes,
you know, a few years. That's the one that there's really limited availability, and that's really what we need. I mean, there's resources to you know, pay their rent, and there's jobs available. It's really that that second housing part.
Yeah, and I think Nicole, and she mentioned something will come to Spokane, right?
She mentioned that IRC may be coming to Spokane.
Yep.
Which will mean possibly more refugee families coming to Spokane. And they have good relationships like with Airbnb and some good relationships with like national apartment complexes. We here already, like this last year, we've started a small housing task force to just to begin to kind of work on the limited housing. We've also been talking to quite a few like investors and developers to
That's
see what, what's in people's hearts and what can people do. Actually like 3 or 4 separate ones. Just one example, there's a group of individuals from a church that's gonna kind of go in together and be developing like a small apartment complex they're going to be building.
Excellent. That's
So
great.
just things like that.
Yeah, great to know. Thank you. Thank you. Let's hear from Tacoma or Seattle, which one they want to start and share with us, please.
I can share. Could you remind me the first
as we discuss growing the number of refugee arrival, what are the resources available in Tacoma for them?
So as we know, the numbers have gone way down. And so, and we have a staff that's transitioned. We have a lot of new staff. And for me, it is a lot just being a new executive director that's been here for 2 years that has watched the decline of the refugee population. It's really for me trying to figure out how we can be more available with the resources that we have to the refugee resettlement organizations. How can we fit in the best way?
Oh.
So we have a lot of resources, as some people may know, which is just education with English language acquisition and adult basic ed and employment and different kinds of services. But I'm curious about how we can do more and be seen more as a resource. And in regard to housing, how we can be helpful with connecting into affordable housing providers, which is something that we've already been thinking about, especially with the TRAP and ERAP money that's come in, that's turning into more of an opportunity for landlord tenant and finding housing. So just that is there. So the second
part, yes, the second part, what are the resources needed? And I think you answered that. Yeah.
Yeah, I think I did too. Childcare is another thing that we've looked into. Mainly just wanting to know how Tacoma Community House can be even more help to the refugee resettlement and more help to refugees individually.
Excellent. Thank you so much, Lauren, for sharing. How about Seattle? I share my screen.
Seattle,
did you see my question?
And I'm with the Human Services Department, and we've had a network approach that has focused specifically on providing community-based organizations a network for access, one sort of a front door, and those known by community living connections. And I need to clarify that this is really for all older adults and persons with disabilities. We also, as City of Seattle, has successfully, I should say the voters have approved another housing levy, and that's renewed another 7-year funding cycle that the city administers. And there are within that resource some parallels that I see, though, that was mentioned earlier with regards to there still being insufficient supply. We've met with community members and some of the access points, providing additional information that Community Living Connections is an access point for our new arrivals, needs to be disseminated, and we're working on that. But we still see, especially during the pandemic, that a lot of especially our target population are the older adults. And we have a wonderful team called that provides for King County's 14,000 or so older adults that are vulnerable. They assess the needs with our partners at the department, DSHS. And so I'd say that they, during the pandemic, were really successful in calling homes for homebound older adults that were not able to access vaccine sites, and coordinating with our fire department on-site vaccinations. I think that was really commendable. And each of our, I'd say that there's a core team of 170 individuals that are each responsible for about 90 or so older adults. The assessments that provide them the ability to age in place and not have to access a really limited resource, our nursing homes. So I just really, my hats are off to them. And we have a nurse contingent that provided additional support, and just the whole team, the Human Services Department. And there's been some, currently we have a new interim director, Helen Howell, who brings forth a really a great degree of knowledge from building frameworks and also her legal background. We also have a new director, temporary, for the Aging and Disability Services Department.
I do have a question.
Okay.
This is Debbie from Refugee.
Sure.
So, I mean, Frank and Annette and Eli and I were like doing all sorts of projects, and, trying to maintain our job focus here. But with refugee resettlement, I feel like you guys have like held it together, with a skeleton crew, right, over this pandemic time, and with like people have left and gone elsewhere, and you guys are down to minimal staff. And I feel like training for a new caseworker is probably going to be pretty big for you guys, and expansion, right, back up again. So is that a concern for resettlement agencies, trying to gear back up, and how you do that and go back to the office and things like that?
Yeah, I would like, I see Chitra on the call. Chitra, would you like to answer that question for Debbie? Your probably have yeah, you're muted, Chitra, if you're talking or you have some technical difficulty. Yeah, I think
so the question was about staffing up, right? Sort of.
yes, after the COVID, yeah, with the challenges and the capacity, and yeah.
That's the question. How are you guys, like looking at staffing up, or how are you going to expand back up?
So I know my organization doesn't do resettlement, right? But we do the employment and education piece. And that's the puzzle we've been trying to figure out, right? Is how do we staff up in a way that we're ready for it, but how do we also not staff up in a way that we don't have the money for it, if that makes sense? But we're going to see, I think we're going to see this increase in, we're going to see this increase before we see the funding increase to match, right? And so how do you do that puzzle? And I think we're going to look at volunteers and stuff like that, and we're looking at other creative ways, like or what we've done in the past, volunteers, interns, those kinds of things, as well as what we've done. I know I'm going to speak for you a little bit here more because your group has done an amazing job using volunteers to get stuff done and support. I mean, it's really impressive.
Yes, Jason, thank you. Yeah, and that's really been very it has been very challenging to be in terms of to try to hold or keep the capacity or increase the capacity after this high arrival. The COVID-19 has a big heavy tools and on the program, and went through layoff, and then now as we are we're having great and good news about new arrival is it is just it has been a lot of struggle, and we heavily relied on volunteer support, as Jensen mentioned, and we have and without that it was very hard. Refugee resettlement heavily rely on funding based on the arrival. So one of the things our national affiliate, so it's looking forward for floor funding. That is which was a good news that we are getting floor funding now in preparation to staff the program and prepare more for to be able to serve arrivals. So it hasn't been an easy when the program is shrinking and then to start it back again. It really takes a lot of work. But it's the community support. It has a big impact. Without the volunteer, it was very difficult. Yeah, so I think I don't know. There is one more minutes left, but there is another. I'll go to the next question, and the question is, how do you address education, employment, and training issues, reaching out to public school districts and college systems?
So like I said earlier, we do English language classes for adults. We have, and in terms of then partnering with the college system, we have pretty good relationships with a couple of the colleges. We even have one partnership where the college teaches or prepares students to take a nursing assistant certification, right? And we case manage the students through that system, and then provide some financial support. And then when they're done and complete the class, helping them find employment as well. So I think that's part of it. Is we've just carved out a pathway for people and providing support. I think that's the challenge with community colleges, is providing support for refugees that don't get lost in that big system. And so in this one case, that's how we've done it. And we're looking for funding to increase those programs, or maybe just provide this type of assistance to any student there. That kind of thing. I think we've talked about a little bit about the employment. It's just, Momar, you did a good job of talking about it too, but just the building the relationships with employers and giving refugees a really honest, this is what it's going to be like, this is what to expect. And if you have challenges, let us know, right? So if you need to quit or need to move on, that one, we can talk to the employer, but we can also prepare you to maybe get another job before you lose this one, or if you're going to quit, how to quit properly, those kinds of things. But again, it's really just providing support through all the processes, and walking right next to somebody as you go through, and making a lot of calls. I mean, I know we make calls. I'm sure other organizations do this as well. Like, we sometimes have to make calls to public school about kids being allowed, or students being allowed, or what supports they can get and what supports they legally have to be provided, that kind of thing. The number of calls we have to make about especially 16 and 17-year-olds who are trying to enroll in school in the school district, is not super excited about them enrolling. And we sometimes have to make that call and remind them that that's your legal obligation to do that. But those kinds of things, it's just, just be an advocate and calling and all the time.
Thank you, Jason. This is great. Yeah. The Como Community House been doing an amazing job, in this, yes, and in all the services, education, employment, and for refugees. And we have this, I really appreciate this, partnership and this work. And Pierce County, especially when we doesn't have, as looking more for refugee providing services here. So it's historically knowing the impact of the services, and we're looking forward for how to more tackling this issues. As you said, it's really it takes a lot of effort. So I'm sorry, I wasn't aware a little bit of the time, so we still have till 12:15. If there isn't any follow-up or any thoughts for the questions just asked, we'll go to the next one.
Can I ask one more question? But go ahead, Nanny.
Sorry.
Go ahead, Jasmine. Go ahead. Oh, I was just gonna add a little bit about what REWA provides. I don't know.
Great.
I'm not the best person to speak to the education and employment because I really don't work on that, but we do have a pretty large youth services department, and I know Mariah expanded into youth services a few years ago, but there's probably, I think there's still a greater need. So we have some support programs for all levels of school, from elementary through college, both after after school programs, and that we have a youth job readiness program where during the summer and during the school year, kids have to go through different job training classes, and they get partnered for an internship and get paid for all their time, all the hours they spend in the program. So it's a pretty cool program and has a really big incentive since they're getting paid and getting really good professional training. But it's for very specific populations. So I do think it's a great model, but there could be more for a broader set of immigrant youth. We seem to enjoy it. And then we have a college kind of connection program to help kids with all their college applications and the FAFSA and everything. Again, I think there's like a much greater need for that beyond our capacity. And I don't know how many other agencies that focus on immigrant populations have programs like that. Recently, I was trying to help some kids apply for scholarships. So we had a contact through some kind of women's university club that just wanted to kind of give refugee scholarships, but again, they could give two, and we had much greater demand. So small things like that make a big difference for kids looking for resources. I just wanted to add the youth stuff.
Wonderful. Thank you, Annie. That's such a great support that you hear from the way how it is, doing by different group. Jasmine, would you like to add something, or I heard somebody else?
Yeah, it was me. As I was thinking about the school districts, actually, I was remembering trying to reach out to school districts is really specific. And I mean, I think we hit this across the state as things get bigger and there's more programs and there's really amazing things that are for specific groups, but it can be hard to track what is where, and particularly if you're not in that particular area. Like if you're a healthcare provider and you think, oh, like I really need to help somebody figure out the FAFSA, but like, where do I refer that person efficiently? I think is a challenge we have that kind of goes across systems to know what is available where, to really successfully connect across all of these different places. And I think that's something that's likely to get bigger as we continue to expand, because hopefully we'll grow services too, but we'll need to do better at interlinking them.
I agree. Thank you, Jasmine.
Yeah, that's a good point.
Yeah. Wonderful. Okay. Yeah, we can spend the whole, more about this question, as this is really very, education, employment training, and how, connect refugees, especially with coming from different levels of education and different variable experience level, how to connect them. But I think that's question number 4 is connected very, it's connected to the question number 3, which is, what is the path to helping newly arrived refugees in finding self-sufficiency? And self-sufficiency, it's very, very broad, term that is, maybe our first understanding point about self-sufficiency, that refugee would be independent and be able, have a job and be able to pay their the rent. But it's in the term, it's going beyond that. It's how the refugee would be connected to resources, how they be able to reach the services they need, with on their own, or how they would be able, to have connection with, for example, medical services, mental health services, resources available for them, how teaching them the way how find out what resources and how to approach them. So what's the path to help them is, so it's different. I will start with one of the main path is supporting them, to when they arrive here, is through through the core services, connecting them with the main core services for them to to resettle or establish. So starting from all the core services during the resettlement period, during the 90 days, it's a path for them to be self-sufficient. That's the goal of the resettlement, to have these people have their basic needs met. So from finding housing, affordable housing to them, providing furniture, enrolling them for refugee health screening, get all, social security, have social security number, connected to the food and cash assistance, and securing appointments for them, scheduling appointment for them for the primary care providers, and have this connection, enrolling children for school and adult for ESL classes, and for employment training as well. Also providing the cultural orientation topics is very, very significant, very important, that they learn about, all the 15, and now they are going to be 16 topics where refugees, know about the main important, very, very big topics that would be related in their life. And also, and that's going beyond that. So 90 days, not enough period for them to be self-sufficient. So that's why, try to help them through, extended case management. So, and to connect them with more services. So it takes a long shot beyond, 90 days, and also continuing for them to train them and educate them, and, to be joining more services. So I think, the main path, the first one is making sure the resettlement period would be as successful as possible. And that's the main, background for them to stand on their feet, and then we connect them with other services. So ensuring that by the end of the 90 days, we be connected with all the supporting services. This is an integral part also for self-sufficiency. Any other thoughts?
Debbie. This
Yes,
is Debbie
Debbie.
again. So what percentage do you feel like resettlement agencies have really, really tough cases, like people that absolutely no English, no past education, no home, anybody around them that like just coming out of the blue, that are really going to need a lot of support, like for like a year, I would say. What would you say the average number of those cases you get, as opposed to like the SIV that's up and running, that probably has some money in the bank, that at least the dad speaks English and kids have been to school a little bit? What do you think your average really high need families are? And is there any way that there's a kind of limit based on how resources you have in our area to like, give more of them around the country? Or do you take those cases as they come, no matter how much they need and how much support they need?
That is a great question, Debbie. Thank you. This is a really great question. Yeah. Specifically, if you talk about, I see the SIV category or community people, it is hard to determine, the percentage, but I'll give you a roughly, if I will say for the year of 2021, or even previously 2020 what we know about special immigrant visa, that they've been working with the US Army. So some of them, they already have skills. They are interpreters, or they have some skilled jobs they're working with. But there are a few of them. I will say I didn't have the exact number, or the percent, but I will say I will consider about 10 to 15% of them, they came with challenges. They are illiterate, like maybe they were drivers or chefs. They are working on, in different levels with the US Army there. And so when they come here and we identify the challenges they are facing to be self-sufficient, we have this family connect them to we have the co-sponsorship group or the volunteer. We want to make sure they have the mentors and volunteer to support them. In addition to, we make sure that after the 90 days, this family will be continued support through like extended case management, and also ensuring that is, the support continue for a long time. And so we have some cases like this, and we have a great successful story where, connected with co-sponsorship groups, and they've been doing well. It takes a long time. It takes about some of the cases takes longer time, but I think extended case management and connecting them with the volunteer, it's really great support for those cases. I would like to give any time for any, my colleague, you want to add any comments on this?
So I would say I would agree with your number, about 10 to 15%, right? Like at least in Pierce County that we see, right? Like there's a population that comes to like our English language classes that cannot read or write in their primary language, right? And so that obviously takes a lot more work to help them get up to that level, to work, to just navigate their community, than others who are highly educated or may have had small amounts of English even in school.
The room may close in 5 seconds, sorry.
All right.
Let's get ready to the main room. Thank you.
Thank you.
Thank you. Thank you, Hamid.
Thank you, everybody, for joining our breakout sessions. We really had some wonderful conversations in all of them. And I'd like to thank our Refugee Advisory Council members who helped to facilitate the conversations as well as took notes. I'd love to give everyone the opportunity to share one or two highlights from your conversation, things that maybe something that's exciting and something that they are recommending. Everybody gets one or two things that you'd like to share. So maybe I'll just start by calling out the different rooms. So in room 1, we had Momar and Jason was the reporter. Jason, what did you learn in your breakout room?
It was nice. We talked about, I will say the one thing for needed services for that first one is mental health. I think we all know that and talk about it, but it's just nice. It's the one thing that, we do education, we do employment, we help adjust status. We do a lot of that stuff, but mental health, the importance of that. I think everybody understands that. And so just calling that out, especially. And one of the other interesting points, right, is we talked a lot about housing and how one of the things that's happening is people are moving further away from maybe centers, right, population centers. And so not only does that put a stress on the housing costs and housing prices, but then the transportation and the availability of services as well. So those are the two things I found most interesting in our conversation. It was a good room.
Thank you, Jason. And thanks to everybody from room number 1. All right, room number 2 was Amira and Nasreen. I'm not sure who was the reporter or who would like to report out from that room. Amira?
Amira.
I was the reporter, and I'm sending you these news from CNN. well, it was amazing. The discussion was amazing, but I can focus on these points. First of all, I like the positive attitude of Jordan from Spokane, because he gave us like an overview of good things that happened to us during COVID-19. Through COVID-19, all of us have been able to get more training, to think more about how to improve our programs. And also we get new funding, we get new programs for self-sufficiency. So we can focus on positive things and move forward. The other thing is that the need is, number 1 is housing. And then the other point is that we need to move from the known to the unknown. What does this mean? This means that we need to know or dig deep to have or to know more about some resources that are available, but we have no idea about. I'll give you just one example. We have in Tri-City, we have what is called Columbia Industries, which offers help mainly for disabled people, and at the same time for people with limited English and limited employment skills. We have no idea that they have an opportunity for job, which is called Opportunity Kitchen, which is a 12-week training that enable people, let's say refugees, with a background in culinary, and most of them have it, at least women, they know how to cook, so they can benefit from such program. But I haven't heard about that program for 13 years in World Relief. So we need to dig deep. Thank you.
Thank you, Amira. And thank you to everybody who participated in room number 2. Room number 3 was Emmanuel and Lenny.
Yes, hi everybody. Really appreciated the contributions from the room, from various folks in there. And I think the main sort of like the main point throughout was housing. And so safe, secure, and stable housing. And, this idea of self-sufficiency, which includes that. also within that, housing and food assistance, right? But within that, kind of, and speaking of digging deeper, kind of looking at how that affects people with different statuses. So like if looking at students who are undocumented, they don't have access to food assistance, right? And or another thing that was mentioned, that there's financial aid that is not available to, let's say, asylum seekers. So these are the things that sort of came across to me. Also, this is looking at what exists in, sort of like rules and regulations. But I think we as professionals working in government and community organizations, as we recruit staff, can we recruit more multilingual candidates? Especially like in government, we can certainly get interns on board from colleges and universities who are former refugees and who are immigrants that speak other languages. It's an asset to our organizations, but it's an opportunity for them to grow professionally. So that's something that we should be doing more of. One other thing that was mentioned is that this sort of overall, like we may be in a bubble here in the Seattle area, but there is not a high level of support for refugee arrivals in the United States in general. I think the figure that was mentioned was like 33%, and that's not very high at all. And so what we could do in our society is to sort of build up this, this welcoming attitude, and how we do that is a big question, but that's something that caught my attention as well. Thank you all for participating, and thank you for listening.
Thank you, Lenny. Thank you, room number 3. All right, we're moving on to group number 4, Marike and Patricia. Marike, do you want to report out?
Yes, just want to thank all of the participants in our room. We had a really interesting conversation. I think we got into more of the deeper roots of the issues. We talked about the need for digital access, not just to give people technology, but also to help them have people that are trained in the technology to help them learn how to use it. Talked about education and apprenticeship opportunities for people with lower levels of English. The issue of housing was also raised, especially in Washington State, where the levels of access to housing are very limited. We talked about a possible program for subsidized employment, which I thought was very interesting, where maybe the first 6 months the person would be able to be employed in a company that was close to where their credentials are, because we've talked about credentialing in the past as being an issue. And so that was very intriguing. The other concerns related to interagency issues were per capita rates. So if there's more refugees coming, how will the per capita rates adjust to be able to serve more of the people coming in? And then the need to increase proportionately the staff, because there will need to be major, massive rehires and new hires of staff for those organizations that are doing the intake. So those were the things that we raised. Thank you.
Great, thank you. It sounds like a fascinating conversation, and you went into a lot of areas. All right, thank you so much, Marike, and thank you, room number 4. Group number 5 was Margarita and Julia. Margarita?
Julia was not here, just Margarita and Margarita. Okay, I was facilitator and I will report. Thank you everybody for participation. And I know we all talk about similar issues, but I will highlight what actually sparkled me. Yes, we talk about housing, but we emphasize that housing for big family is a problem. And one of the offer was how we can bring message to people in a construction business who build the new apartments and new houses, not to build for family of 1 or 2, but for big family, we have 6+ people. We need like a 3, 4, 5 bedroom apartments, which almost impossible to find or very rare, that's a message should be sent to community and the business of construction and developers. That's a great comment. I like it. And also we talk about right now during COVID, when many agencies working remotely, what is cons and pros of this process. For education, we found like for ESL classes in the colleges, it's a great, bring flexibility for people who have a good digital literacy. But those people who never was educated in like a digital innovation system, it's a challenge. And for parents who have children in a school, it's very hard when children don't have a opportunity to build social skills and to make a homework if parents are not like a digitally literal people and also have a limited English access. All instruction given in English, and parents couldn't help children. Even this flexibility is offered. That's a big, problem for our people. And also I wrote down when right now we have some agency available for remote services, for some agency is available for in-person. Client don't know how many resources available. They usually bring all questions to one person who is available to meet in person. And it's very important for us, like agencies, to explain client about all resources and stay like collaborative and help each other, make a referral to different agency and help client to navigate, between the agencies and available resources. Also, we touched a little bit about food stamps fund, which might be enough for a big family, but if it's a single person who has only $234, dollars, and food is expensive right now. It's actually cost, of food is raised during pandemic. And some people who came from different country, they have a cultural food, not cultural food available in the store. If they go to ethnic store, it might be more expensive. That's a question we thought, maybe this fund should be raised. We don't know how it's doable, but that will be good. And the good thing, there is a housing program like in Clark County, our office help, to have a housing assistant, and it's available for our people. It's a great, support. And also a new program like Family Self-Sufficient Plan. We start to implement this fund and this new project and talk with people what is a short goal versus long goal for success. That's what I have probably.
Thank you so much, Margarita and Margarita for doing both. And thank you to room 5. Room number 6 is Abdul and Dina, and I think Abdul, do you want to report out?
Yes, Sarah. So number 6, we had a very good conversation. We covered them to report all of them here. I'm going to go with the 2 highlighted topics. We discussed the affordable housing and jobs and job training. For the affordable housing, we noticed that prior to COVID, even though now it's hard to find affordable housing, especially for the new arrived immigrants and refugees, the families has to stay in a hotel room for a week or 2 until they find the housing, an apartment or house, something to move in. So even though after that, once they get into a house or apartment, once they pass that first 90 days, it's a little hard for them to pay the rent since the rent is expensive. Also, we discussed the jobs and jobs training. The new arrived families, we noticed that they need more job training programs, especially in Whatcom and Skagit counties. Programs like community jobs, we need them so clients can work, get some work experience, and make some money to pay their bills.
That's wonderful. Thank you so much. I know that we'll have a Refugee Advisory Council business meeting on Monday, and so I look forward to getting all of your notes so that we can start to brainstorm on how DSHS may be able to help coordinate resources or address some of these issues. I really want to just say thank you to all of you for your attention today and your time. We are grateful every time that we have a quarterly public forum for all that come to join us to talk about how we can continue to make Washington a welcoming place. Thank you for your time today, and we look forward to seeing you again all very soon. Best wishes, have a wonderful weekend, and thank you.